Pharmapal.
Iguratimod in autoimmune diseases and bone protection. Hello everyone. Welcome back to our channel. Today, we're diving into an exciting topic that touches on autoimmune diseases and a promising treatment called Iguratimod. This drug is gaining attention for its potential to protect bone health while managing conditions like rheumatoid arthritis, or RA for short. First, let's clarify what we mean by autoimmune diseases. These occur when the immune system mistakenly attacks the body's own cells. Symptoms can range from mild fatigue to severe inflammation. In fact, the National Institutes of Health estimates that around 23.5 million Americans are affected by autoimmune diseases. Iguratimod is a relatively new disease-modifying anti-rheumatic drug, DMARD, primarily used in Japan and China to treat RA. It works by modulating the immune response and reducing inflammation, which is crucial since RA can lead to significant joint damage and pain. Now, let's break down how Iguratimod functions. Cytokine suppression. It suppresses key inflammatory cytokines like IL-6 and TNF-alpha. These cytokines are often elevated in autoimmune conditions and contribute to inflammation and tissue damage. Bone protection. Iguratimod plays a role in maintaining bone health by influencing the balance between RNKL and osteoprotegerin, OPG. An imbalance between these two can lead to bone erosion, a common issue in RA patients. Synergistic effects. Studies have shown that when Iguratimod is combined with other treatments, like methotrexate, MTX, it can enhance the therapeutic effects, leading to better outcomes for patients. Clinical trials have indicated that Iguratimod can significantly reduce the RNKL/OPG ratio, which is a biomarker for bone loss in RA patients. This reduction is associated with decreased bone erosion and improved joint function. Why is bone health so important in RA? Well, bone loss can occur rapidly in patients with RA, often leading to deformities and disabilities. Protecting bone integrity is essential for maintaining quality of life and functionality in these patients. What we mean by autoimmune diseases. Definition: autoimmune diseases occur when the body's immune system mistakenly attacks its own cells. Symptoms: these can range from mild fatigue to severe inflammation, affecting various organs. Statistics: did you know that approximately 23.5 million Americans are estimated to suffer from autoimmune diseases? Some sources even suggest this number could be as high as 50 million. Now, let's talk about the treatments currently available for autoimmune diseases. Nonsteroidal anti-inflammatory drugs, NSAIDs. Corticosteroids. Disease-modifying anti-rheumatic drugs, DMARDs. While these can be effective, they often come with drawbacks such as low cost-effectiveness, adverse side effects, patient non-response. This is where Iguratimod comes into play. Iguratimod is a relatively new DMARD primarily used in Japan and China to treat rheumatoid arthritis, RA. Mechanism of action: it works by suppressing specific cytokines and immunoglobulins, notably IL-6, TNF-alpha, and IL-17. Dosage: typically, patients might start with 25 mg per day for the first 4 weeks, increasing to 50 mg per day thereafter. So, what makes Iguratimod stand out? Unique mode of action. Unlike traditional DMARDs, Iguratimod targets different inflammatory pathways, making it effective for patients who don't respond to other treatments. Bone protection. It also plays a crucial role in protecting bone health, which is vital for patients with RA. Interestingly, research is expanding into Iguratimod's efficacy beyond RA. Studies are investigating its potential benefits for inflammatory bowel disease, IBD, Kawasaki disease, CADD, refractory lupus nephritis. These promising findings suggest that Iguratimod could be a versatile tool in managing autoimmune conditions. In clinical trials, Iguratimod has shown promising results in reducing disease activity scores and improving overall patient outcomes. A study highlighted that Iguratimod could effectively lower the RNKL/osteoprotegerin ratio, a biomarker for RA bone loss. Combining Iguratimod with other treatments, such as methotrexate, MTX, has shown enhanced effects. Research indicates that this combination can synergistically lower inflammatory markers more effectively than either drug alone. Iguratimod isn't just limited to RA. Studies have also explored its effects on conditions like inflammatory bowel disease, IBD, multiple sclerosis, and even cancer-related cachexia. For instance, in models of IBD, Iguratimod significantly reduced inflammatory cytokines and improved gut health. Safety profile. While Iguratimod is generally well tolerated, some patients may experience gastrointestinal side effects. Patients need to discuss potential risks and benefits with their healthcare providers. In Figure 1, we see the structural formula of Iguratimod alongside other commonly used MARDs, like methotrexate and leflunomide. What's interesting here? Iguratimod is a small molecule that is orally bioavailable, meaning it can be effectively absorbed in the gastrointestinal tract. This structural feature is crucial as it influences how the drug interacts with the body and its efficacy in treating RA. Moving on to Figure 2, this illustration highlights the mechanism of action of Iguratimod. Key points. Iguratimod targets various inflammatory cytokines such as TNF-alpha, IL-6, and IL-17. It suppresses the production of these cytokines, which are pivotal in the inflammatory cascade associated with RA. This suppression leads to a reduction in inflammation and ultimately helps in alleviating symptoms for patients. In Figure 3, we explore the relationship between RANKL and osteoprotegerin, OPG, in the context of bone health. What does this mean? RANKL is essential for osteoclast differentiation, which is crucial for bone resorption. The balance between RANKL and OPG is vital. An imbalance can lead to bone erosion, a common issue in RA patients. The data suggests that Iguratimod effectively lowers the RANKL/OPG ratio, indicating its potential in protecting bone health. Next, we have Figure 4, which presents histopathological findings related to bone destruction. Observations. The figure shows a comparison of osteoclast activity across different treatment groups. Notably, the high-dose Iguratimod group significantly reduces bone resorption compared to the vehicle group. This suggests that Iguratimod helps with inflammation and plays a protective role in bone integrity. Figure 5 illustrates the effects of Iguratimod on osteoblast differentiation and bone resorption. Key findings. The number of TRAP-positive multinucleated cells, which indicate osteoclast activity, decreases with Iguratimod treatment. This reduction is dose-dependent, showcasing the drug's effectiveness in promoting bone formation while inhibiting bone resorption. Now, let's look at Figure 6, which focuses on the histopathology of vascular walls in a murine model of vasculitis. Highlights. The figure shows the effects of Iguratimod on vascular inflammation, indicating less disorder in the vascular walls compared to the control group. This suggests that Iguratimod may have broader anti-inflammatory effects beyond just joint health. In Figure 7, we examine the potential anti-tumor effects of Iguratimod. What's notable? While Iguratimod does not significantly inhibit tumor growth, it does reduce IL-6 levels, which is associated with inflammation in cancer. This finding opens up avenues for further research into Iguratimod's role in cancer-associated conditions. Finally, Figure 8 summarizes the clinical trials conducted with Iguratimod. Key takeaways. The trials indicate that Iguratimod is effective in reducing disease activity in RA patients. Importantly, it has a favorable safety profile compared to traditional DMARDs, making it a viable option for long-term management. To wrap up, the data presented in these figures highlight the multifaceted role of Iguratimod in managing autoimmune diseases and protecting bone health. Its ability to modulate inflammatory responses and promote bone integrity makes it a significant player in the treatment landscape for RA. Thank you for tuning in. If you found this information helpful, don't forget to like, subscribe, and hit that notification bell for more insightful content. See you next time.
Pharmapal.